Out of thousands and thousands of patients over the years, one of the more enduring memories I have is when I first met a 35-year-old young man who had been told that he was going to lose his molars. That is hard for anyone to hear. For someone who's 35, that can be even harder. When you look at the situation, is there enough bone for implants? What is the longevity of those implants going to be? For a 35-year-old, this becomes a very, very, very disheartening situation. So when I first met him, he did not have hope. Now, here we are 15 years later. We treated his full mouth at that time. 15 years later, I just had an opportunity to see him and all the teeth are there. And that's pretty amazing. Sure, is it possible that tooth loss could occur in the future? Of course, anything's possible. Could be decay, could be periodontal disease, trauma, whatever the case might be. But at least now we've got 15 years behind us. And if we have to get into an implant situation, he's at a different point in his life where that may be financially possible now. He's at a different time in his life where we may not have to have an implant last 50 years. So if nothing else, LANAP gave him hope for his teeth, hope for function, hope for a smile. For the last 15 years, it still is going to continue on into the future. And now if we need to get into something else down the road, it's happening at a better place and time in his life